if you have two drugs, say you're using Safeguard and you're using ivermectin, and say Safeguard is 90% effective and ivermectin is 75% effective, or even less, 70% effective, um, then by rotating drugs, you're going from one that's highly effective to one that's not as effective. You see what I'm saying? So if you're rotating it and going back and forth, then your treatment at one time isn't going to be as efficient as that, as the other time. And moreover, when you're deworming with one drug and you're deworming with the other, it's building up resistance to two drugs at the same time.
Oh, okay.
If that makes sense, because you're not just using, when we had started saying don't rotate your dewormers, then we had started saying use one dewormer until that one fails, and then start on another dewormer. That was the recommendation. But in New Zealand, they did a study, and they in New Zealand they have access to drugs that are combination drugs. So they have more than one active ingredient in their drugs. In other countries in the world, we don't have that in the US. But New Zealand, they did a study where it basically showed us that that combination treatments, that is deworming, if an animal shows clinical signs and you're still using targeted selective treatment. I see somebody put there FAMACHA. You're still using your FAMACHA. You're still using, those are the tools that we have to deworm more animals, right? To decide who needs deworming or not. We use tools such as the FAMACHA score, and I'm not sure how many of you have heard about the 5-point check. All right, so
yes, you can do a quick review for us.
Okay, so the FAMACHA, it assesses an animal for their degree of anemia, and anemia is due to the blood-sucking parasite, the barbacore worm, and in the parasite season, if you see, and I guess in Jamaica all year, if you know that you're feeding right and your animal isn't nutritionally deficient, if they're anemic, then it tends to be parasites, due to parasites, right? And so the FAMACHA score assesses their eye on a scale of 1 to 5, with 1 being bright red and healthy and 5 being pale, basically at death's door, pale white. And I have some good pictures of that if anyone wants to see it, but I'm sure most of you, if you're producers, you might have seen it before. But you would deworm a 4 and a 5 that are pale, and you leave a 1 and a 2 alone, and a 3 that would just be based on other clinical symptoms. So the FAMACHA in and of itself, it just looks at the eye. So we were training folks to look at your animals, look at their eyes. If they're pale, deworm them. If they're not, leave them alone, because that leaves a few animals and the worms that are inside of those animals in refuge from the drug, right? So they're passing susceptible worms onto the pasture, while the ones that you dewormed, they will only be passing resistant worms. So it's basically diluting the worms on the pasture.
Dr. O'Brien, thank you so much